All right, I am going to brain dump. Hi, my name's Hannah. I'll be your student nurse today. Go over hand hygiene. I have provided privacy behind us here. Can you state your name and date of birth for me, please?
Faith Green, 11/5/2000.
I'm just going to verify that on your wristband here. Looks good. Your provider asked me to come in today to complete a head-to-toe assessment. Would that be okay for today?
Yep.
All right. For this assessment, I will need PPE, and I will apply when necessary. Do you have any allergies that I should be aware of?
No.
Okay. So starting with, are you in a comfortable position?
Yes.
Okay. All of the equipment I'm going to use today has been cleansed and sanitized. I have completed a health history assessment on Faith before doing this head-to-toe assessment, so that is complete. Okay, so just starting with a few questions here. When was your last physical?
A year ago.
Have you had any recent surgeries?
No.
Do you have any current injuries?
No.
Okay. Your posture looks good. Your behavior is good. You're polite. You're responding quickly. Your hygiene looks good. Do you need any assistance before we begin with toileting? Do you have any hearing aids, glasses?
No.
Okay. All right. I'm just gonna check and make sure I hit everything. So, your age and gender are normal for your responses. Can you restate your date of birth for me, please?
11/5/2000.
Do you know what day it is?
Thursday.
Do you know where you are right now?
Southwest.
Do you know how you got here?
True.
Okay, so the patient is alert oriented ×4, so all is good. So I am going to begin with some vitals here. So I'm going to have you come over to the scale. Okay.
What's that?
Okay, and then I'm going to have you turn around. Okay. I'm going to come over here and document. Okay, and then I am going to get your temperature next. place this under your tongue. .8, okay, normal temperature. I'm gonna come over here and document. Okay, and then I'm going to get patient's pulse here.
Or just study, not worry about your teacher. Oh. Right, exactly. If you don't want it, if you feel that it's busy work and you don't want to go, you have another way of studying and keep it that way, don't worry about it. But if you want to use that, you have to wear it, you can't just like have it sit right next to you.
Okay. Pulse is 72, respirations were 15. So now I'm going to get the patient's blood pressure.
Or you could be like, you don't have to worry about it.
Making sure that the cuff size is correct and that the arrows are pointed at the artery. Okay, I stopped feeling a pulse at 120, so now I will come over and grab my stethoscope. I'm going to add 30, and I'm doing 2 millimeters of mercury.
I thought it was a clever idea to do that, didn't you? Yeah.
Blood pressure was normal, 126/62. Set these back down.
Any other questions?
Okay, and then
Anytime. Please call me or text me.
all of the vitals were ideal.
I'm not sure what I'll do. But just call me.
So now going on to skin. So just inspecting the patient's skin here, looking at the color, looking for any lesions, bruising, discoloration, and also just palpating here, just feeling for any bumps, masses, and tenderness. Not feeling anything. Also checking for any edema. I'm not seeing any edema with this patient, but the edema scale is 1 plus 2 mm rapid response, 2 plus is 4 mm, 10 to 15 seconds response, 3 plus is 6 mm with a 1 to 2 minute response, and 4 plus is 8 mm with a 2 to 3 minute response, and that's considered grossly edemous. Not seeing that anywhere on this patient. Also just verbalizing the lesion mnemonic, so A, B, C, D, E, so asymmetry, border, color, diameter, and evolving. Checking the skin turgor, quick response. Then also looking at the patient's nail texture and capillary refill. All looks normal. I we'll have you take your socks off and I will apply gloves. For this patient, I would use her hands, not her feet, as her toenails are painted, but just checking the texture, and then you can check the capillary refill, but like I said, easier with the hands. And then I think that is all for skin. So then next I am going to, I guess one thing I did not mention with the skin was just checking the temperature, but temperature felt normal. So then next I'm going to go to the head. So inspecting the head, I'm going to have you smile for me. I'm going to have you frown for me. I was checking the facial nerve. So then I will palpate the head, feeling for any bumps or masses. Do you have any tenderness whenever I push down?
No.
Okay. Looking at the hair looks clean, symmetrical on each side of your head, soft. Just making sure I hit everything for head. So your head is symmetrical, and I am going to do the trigeminal nerve test. So I am going to grab this alcohol wipe here, and I'm going to hit 6 points on your head. I'm going to have you close your eyes for me, and I'm going to have you tell me where the alcohol wipe is located.
Forehead, left side, right cheek, left cheek, chin, forehead, chin.
Perfect. All right. And then next I will be going to the eyes. So looking at your eyes, they are in alignment and they are symmetrical. Next I'm going to take a look at your iris and the color, looking for any lesions. I am going to check your pupils here for dilation. I'm just going to lower the lights here. So I'm going to have the pen light go into your eye and then go away from it to check your dilation. Right. Other side. Okay, pupils are dilating, which is good. Then next I am going to do the 4 fields test. So I'm going to have you tell me when you can see my fingers.
Okay.
I'm going to do it on each side.
Okay. Okay.
All right, and then checking your ocular, trochlear, and abducens. I'm going to do the cardinal test. So I'm going to have you tell me or follow my pen light as I go up and down into the side. Okay, perfect. And then I am going to look at your sclera. It is white, which is normal color. I don't see any lesions. I am also checking your conjunctiva. So I'm going to have you pull up and I'm going to have you pull down. So color is normal. It's reddish pink. It is moist, which is good because if it was dry, it could mean that she is dehydrated. Also taking a look at your eyelashes and eyelids, checking for any edema, drainage, any burnt off eyelashes, which could indicate the patient smokes. I'm not seeing any of that. Just making sure I hit everything in the eye. So I am going to also do the eye vision test. So I'm going to have you place one hand over one eye, and I'm going to have you read the bottom line to me.
LTFFH.
Okay, and then I'm going to have you do the same thing on the other side.
LTFFH.
Okay, so this would be 14 inches away from the patient. I was a little bit farther back. So that is complete. So that was for the optic nerve. And then next I am going to do your ears. So taking a look at the external part of your ears, I'm going to have you pull your hair behind your ears, just checking for any redness, any foreign bodies, which you do. She does have 2 earrings in on the side, but they look normal. They don't look infected. There's no drainage. Next, I'm just going to apply gloves. And then I am going to pull down her pinna here. I'm going to do it on this side so you can see. Just checking behind the ear here. And then also just pressing on her tragus. And then I'm going to come over here. And I'm going to look inside the inner ear. For adults, we pull the pinna up. For children, we pull it down. So for her, I'm going to pull up and making sure that this is on. Okay. Okay. All looks normal. The color was normal. And there was no foreign bodies inside the ear. Then next, I am going to do the nose. So checking the external part of your nose, looking at the color, looking at any deformities, and I'm not seeing any of that. And then taking a look up in your nose here. So just checking for any foreign bodies such as polyps or drainage or bleeding, checking to see if she has a deviated septum. Wasn't seeing any of that. Then I would palpate the sinuses and maxillary, feeling for any tenderness or swollenness. Do you have any pain with that?
No.
Okay. And then after the nose, I believe I'm going to the mouth. So looking at the external part of your mouth, it is symmetrical. Your lip color is normal. It's red, pinkish. If it was blue, we would be concerned for dehydration. I'm going to have you open your mouth for me. Taking a look at your buccal mucosa, looking that it is moist and pink in color, which it is. And then taking a look at your gums here. They are pink in color. Taking a look at your teeth, making sure you have all of them. She has 28 teeth, which is normal for adults. Taking a look at your tongue. Taking a look under the tongue. Uvula, tonsils, all that good stuff. With the tonsils, we are checking not tonsils. The uvula, we're checking the hypoglossal or vagus nerve. And then for gag reflex, I would take one of these tongue depressors here, and I would place it on her tongue and make her gag, but I'm not going to do that today. So that would be checking off the glossopharyngeal and vagus. And then I am going to I would also look at her hard and soft palate, checking to see if there's any abnormalities such as a cleft palate. Not seeing any abnormalities within the mouth. So then next we can go on to the neck. Inspecting your neck, I'm going to take a look at your lymph nodes and I'm going to palpate. So, applying some gloves. Checking your preauricular, your postauricular, your occipital, your submandibular, your tonsillar, your submental, your superficial anterior cervical, your posterior cervical, and then I'm going to have you turn your head, and this is how we check the deep vein cervical, and then the supraclavicular along the clavicle here. And then I would also palpate your trachea and thyroid, which I am going to do here in a minute. So feeling the trachea here, feeling for any masses or tenderness, and then also feeling the thyroid. And then next I would feel the carotid on both sides, making sure you only are pressing down one at a time. And then I am actually going to have you lay flat on the bed here. And then I'm going to come around this side. And I'm just going to be, here's the thing. I'm just going to be watching her. There we go. Just taking a look at her jugular vein here, making sure that it is pulsing. Yep, all looks good. And then I am also going to, you can sit up if you would like. And I'm also going to auscultate the carotid. Okay, and for that I use the bell side. And then after the neck, I am going to respiratory. So I am going to begin with looking at your anterior, posterior, and lateral ratio. The normal ratio is 2 to 1. Taking a look here, your anterior, posterior, and lateral do look at like a 2 to 1 ratio, which is normal. And then I am going to do the chest excursion. So I'm going to place my hands here and I'm going to have you breathe in and out for me. And my thumbs moved in and out, which is good. And then I'm also going to do it on the back side here. I'm going to have you breathe in and out for me. Yep, and my thumbs moved, which is good. I am just, since I'm back here, I'm going to do the tactile firmitis. So I'm going to have you say 99 3 times. 99, 99, 99. Perfect. And I'm going to come around on the front side here. Do the same thing. 99, 99, 99. Okay. And then after the tactile firmitis, I am going to auscultate. So for anterior, it is 10 spots. So we'll begin with that. I'm going to have you take your shirt off for me, please.
Do you want me to stand up? No.
No.
Okay.
All right, I'm going to take a listen here. Okay, and then for Lateral, it's 4 spots. So I'm going to have you lift your arm up here and just breathe in and out for me. All right, and then on the back side, it is 18 spots. So I'm going to have you breathe in and out for me. Okay, you can put your shirt back on if you would like. And then I'm going to take a look here, make sure I hit everything. Okay, so her rate and rhythm were normal. So next I'm going to be, that's fine, sorry. So for cardiovascular, I'm going to inspect the precordium. So just taking a look here. Yeah, you can lay down if you would like. Taking a look and looking for any lesions, bruising, masses, bumps. And then I will apply some gloves here. And I will then palpate the precordium, feeling for the same thing, any lesions or masses. And then next I will begin with auscultating the points here. So starting with the aortic, going to pulmonic, going to Erb's point, mitral, and tricuspids. So starting with aortic. I don't remember if you use the diaphragm or bell side, so I'm going to do both. Okay, all sounded good. So then next I will listen for the apical pulse, and that'll be for 1 full minute. We listen for that in the tricuspid valve, so that is where I'm going to take a listen here. Okay, you can sit back up if you'd like. Just document the apical pulse. Okay, and then So where we hear S1 the best is in your mitral valve, and you hear S2 the best in your pulmonic valve. You hear both S1 and S2 the most clearly in Erb's point. And then going over the pulses here, so starting with the temporal, and then already did the carotid, but carotid, and then brachial, radial, ulnar, and then verbalizing femoral, and then popliteal, dorsal, dorsal pietus, and I don't remember the other one. Posterior tibialis. So checking all of those pulse points. And then going into the abdomen. So I'm going to have you lay down for me. And then gloves here. I'm going to put a pillow underneath the patient's legs here. And then I'm going to have you raise your shirt for me. And then I'm just inspecting the abdomen here, looking for any masses, lesions, bruising, redness. And then I am going to auscultate, starting in the right lower quadrant and going clockwise. Start with the bell here. And the diaphragm, because I don't remember which one. Okay, and then also auscultating the aortic, renal, and iliac. And then trying to think what else. Oh, well, the reason why I have my gloves on, huh? Palpating the abdomen. Okay, and I'm starting in the right lower quadrant, just slightly palpating. Her bowels are hyperactive, which is good. Good bowel sounds. All feels normal. There was no guarding or rigiding in the abdomen. And then I am going to have you sit up for me. I can remove this. So, starting with your musculoskeletal. So I am going to apply more gloves and I'm going to inspect and palpate. So I am going to take a look at your submandibular and I'm going to have you open and close your jaw for me. Okay, perfect. And then I am going to have you move your head from up and down, side to side, and then move your neck. Then I'm also going to feel. Okay. And then I am going to have you shrug your shoulders. I'm going to feel while you do that. Okay. And then I'm going to have you just move your elbows, adduction and abduction, and supination and pronation. Just feeling for anything. And then also your wrists, so supination and pronation. And then I'm going to have you rotate your wrists. Okay. And then I am going to have you stand up for me. And I'm going to have you turn around so I can take a look. I'm just feeling for spine. Checking for any lordosis, scoliosis, or kyphosis. Not seeing or feeling any of that today. I'm going to have you sit down for me. No, I'm not. Sorry. Can you stand up for me? And then I'm going to have you adduct and abduct your left leg. Yep, and then your right leg. Oh, I did my left one first. Sorry. Okay, and then I'll have you sit down. And then I'll have you just flex your feet, plantar and dorsal. Perfect. And then I'm just going to have you rotate your ankles there. Okay. Yes, so now I'm going to do your muscle strength. So I am going to have you shrug your shoulders for me, and I'm pushing resistance. And then I'm going to have you push your elbows out and try and pull them in. And then I'm going to have you put your arms like this, and you're going to push and pull. There we go. And then I'm going to have you push and pull with your hands. And then do a hand grip. Okay. And then I am going to have you stand up for me. And I'm going to have you just bend over. I'm just feeling her spine as she bends over. No abnormalities. And then I'm going to have you can sit back down, and then we'll check your adduction and abduction in your hips here. Both of them here. Okay, and then pulling away. Okay, and then pushing down, pulling up. Okay, muscle strength is good. No muscle weakness with any of the tests. So then next I am going to have you stand up for me one more time. And I'm going to have you walk 10 to 20 feet this way towards the camera and then walk back. Patient has good gait, no issues with walking. And then I'm going to have you stand in place and close your eyes. This is the Romberg test. If the patient were to fail the Romberg test, they would begin to sway. She is not displaying any of that, so you can sit. And then lastly, neurological. So I am going to begin with asking you a couple questions. So can you repeat the numbers 1, 3, and 5?
1, 3, 5.
And then backwards, so 5, 3, 1.
5, 3, 1.
All right, and then I'm going to have 3 words I'd like you to remember, and I'm going to ask you them again. So blue table horse.
Blue table horse.
Okay. And then are you currently married?
No.
Okay. Can you repeat those 3 words back to me?
Blue table horse.
Okay. And then I am checking the, so I'm going to have you place your finger on your nose, and I'm going to have you place your finger on my finger when I move it. So go ahead. And then do it again, and then do it again. But then put your and then put your finger back on your nose. So let's try it again. There we go. Perfect. All right, and then I'm going to have you lay down one more time. And for this, I am going to use the tongue depressor. And I am going to check the Babinski response. So patient... Okay, so patient was sensitive to that, which is good. In babies, we see curling of the toes. In adults, we shouldn't, and she did not. So, finally, I am going to go over the 12 cranial nerves. So, for olfactory, I am actually going to have you place, close your eyes, and I'm going to have you place one finger over one nostril, and then I'm going to have you tell me what you smell.
Oh, wait.
Okay, and then do it on the other side.
Same thing.
Okay. So that is checked off. And then for optic, we did the eye vision or the vision tests with the eye chart in front of her, 14 inches away from her face. And then so for ocular motor, trochlear, and abducens, that was the cardinal, where I put the pen light in front and had her follow with her eyes. The trigeminal is where I put the 6 points on her forehead and she answered all correctly. Facial, I had her smile and frown. For glossopharyngeal and vagus, I verbalized that I would put a tongue depressor on her tongue and have her gag for a gag reflex, but I did not state that I would also have her say ah. So can you say ah for me, please? Okay. All looks normal. And then for an accessory test, that is where I placed my shoulders on the patient, or placed my hands on the patient's shoulders and had her shrug. And then for hypoglossal, so for the acoustic, I did not do the whisper test, so I'm going to do that now. So I'm going to have the patient rub her finger over her tragus, and I'm going to repeat, or I have her repeat the numbers that I whisper in her ear. So 5, 3, 1, 1, 2, 4. Okay. And then so for hypoglossal, the last one, I'm just going to have the patient stick her tongue out for me and move it from side to side. Perfect. Okay, so that completes the head to toe assessment. Before we end, do you have any questions for me? I have the time.
No.
Okay, so then I would make sure that all my equipment is cleansed and sanitized. I'm going to come over and perform hand hygiene. Her bed is lowered and side rails are locked. Her table is within reach. Her call light is within reach. Her pathway is clear of any obstructions. And I am going to go and document.